Hi, my name is Brooke Berge, and my topic is deaf and hard of hearing. So first off, there are two different types of deaf. There is deaf that has a lowercase d, and there's deaf that has an uppercase d. Lowercase deaf refers to the audiological condition of not hearing. Then there's uppercase deaf, which refers to a particular group of deaf people who share a language, which is American Sign Language. It's also considered a culture. Then there's also hard of hearing. Hard of hearing is a person with a mild to moderate hearing loss, or it can also be someone that doesn't have or want any cultural affiliation with the deaf community. So they can be deaf, but they just don't want any affiliation with learning ASL. There are also a few terms you should know that just shouldn't be used. Deaf and dumb is the first one. So this basically means deaf and silent, which is just a wrong term to use because people that are deaf are not silent. They have many different ways of communicating. And there's also deaf and mute, which is also the same thing. They have plenty of ways to communicate besides actually speaking verbally. There also is hearing impaired. People don't like this term just because hearing impaired has the word impair, which just is focusing on what they can't do. Then there also is different levels of hearing loss. So there are 4 different levels. First off, there is mild. So they also go by different levels. So there's 25 to 40, there's 40 to 70, 70 to 90, and 90 to 20. Basically, they're just different levels of hearing. So if they can hear anything like below that range, that's what they are considered. So mild is 25 to 40, moderate is 40 to 70, severe is 70 to 90, and profound is 90 to 120. Since it's a little hard to describe, I do have a video that kind of explains it better. So let's pull up this.
With Wix, you can create a professional website that looks stunning. Just go to Wix.com. The best part is,
1, 2, 3, 4, 5, 6, 7. Aha! You're on my apartment building on Granite Avenue. You owe me $300. Get it up?
So this is just showing how it's a bit like mild right now.
I'm
This
just
is
like
what a
them
mild
big
hearing
tycoons. I play
loss
to
would
win.
sound like.
Now, Barney, pay up or get out of the game.
Then this is moderate hearing loss.
I don't have any more money either. You got it all. Then I'll take a mortgage on your office home. Come on.
And then this is severe, so you can just tell it's very, very muffled.
I will not have you talking that way to our guests. Come on, Barney. I think we'd better go home.
Okay. So now back to the PowerPoint. So hopefully I described it a little bit better for you, but I also have this next slide. So this just shows so the different sound pressures. So basically it has like our normal speech range that's just right in the center for you in the red. It's normally around like 55 area. That's just like a normal conversation, like right now how I'm speaking. And then it also goes from extremely quiet, which would be 0. People can normally hear around like 0 to 10. It's common if you just have perfectly fine hearing. And then it goes slowly up. So they actually have it related to like just common noises that everybody would know. So like a vacuum cleaner would be 70. There's also like the loudest one, jet engine, which is just actually in the threshold of pain. So it's actually not good for your ears, which can create hearing loss. So next, we're going to go through the different types of causes of hearing loss. So first off, I just wanted to explain to you how hearing all works out. So we have the anatomy of the ear up there on the screen. So what happens with sound is basically sound waves, they'll pass through your outer ear, and then these cause vibrations at your eardrum. So then the eardrum, and there's 3 little tiny bones that are right past the eardrum. It's the malleus, the incus, and the stapes. So those 3 bones with the eardrum, which are all in the middle ear, they just amplify the sound. And then this passes through the cochlea, which is that spirally area there. Once it passes through there, there's actually tiny little hairs all inside there. So all the tiny little hairs, they help translate the vibrations to electrical signals, and then those are then transmitted to the brain. So that's just basically how hearing altogether works in the ear. So obviously, if any tiny little thing is off with any part in the ear, then hearing can obviously be lost or just impaired slightly. So first off, a cause would be damage to our inner ear. This could be from multiple things, just aging. Things happen as you're getting older, obviously. Your bones are deteriorating and everything. So just simple things can happen with aging that can just um, cause some hearing loss. Also, loud noise is a super common one. People are always blasting music and then having headphones in. So any type of loud noise can also cause hearing loss. Next up is buildup of earwax. I'm sure that people almost everybody uses Q-tips, but they actually, although they do get some earwax out, they can also push it back, and pushing it back and push it way, way back far into your eardrum, which can obviously block the canal, which will be very preventative with hearing loss. Next is infections, ear infections. I mean, they can be quite minor, but they can also be extremely severe, and they can cause a lot of major hearing loss. Next, after that, we have a ruptured eardrum. So I'm sure you've all heard of a ruptured eardrum. Extremely painful. This can happen from a few different things. First off is a loud blast of noise. This could just be anything. Like we said before in the earlier slide, like a jet plane, if that just like a noise that catastrophically loud just happened right next to your ear, that could easily rupture your eardrum, but it can also happen in much simpler, not drastic ways, such as like a sudden change in pressure. I've known people that they had to do some things with their ears and use medication when flying on a plane just because of the change in pressure. Also, there is poking your eardrum with an object. This goes back to using Q-tips. Sometimes little kids think it's funny just like stick it in their ear, but they can so easily just poke their eardrum funny and they can rupture it, which is really scary. So you definitely have to be careful with Q-tips, which actually they have people now that it's like earwax removal you can do instead, which is a lot better for your ears. So next off, there is hearing loss and exercise, and just the relationship between the two. So definitely are some negatives and positives. First off, for negatives, so whenever you're working out and exercising, it's very common to have music just to motivate you, keep you going, keep a rhythm, which is a negative just because it's definitely hard to keep yourself motivated when you don't have the music. But this is just one negative, and I think that definitely the positives outweigh the negatives in this case. For positives, it's just overall health. So when you are overweight, you have an increased risk of hearing loss. So by getting in shape, you definitely just decrease your odds, which is great. And also, by being just more in shape and everything, you're decreasing your risk of a lot of common diseases that cause hearing loss. So this could be diabetes, heart disease, cardiovascular disease, like anything. So many diseases can lead to other things. So honestly, it's just better to try and keep yourself overall healthy. So then next up, we have different ways to manage hearing loss and also just different options that people have depending on their severity. So first off is hearing aids, a very pretty common one. A lot of kids in school have hearing aids, and then teachers can hook up little microphones so they can use that in class. That way they can hear them because lip reading would be quite hard from that distance. Another very common one is American Sign Language. I have the alphabet up on the screen for you. This is super common to be used with a bunch of deaf people, and as we said before, there is that culture of them too. But for those who are just not a part, choose not to be a part of the culture, they have plenty of other ways to do things as well and communicate with others. So there's also lip reading. This is extremely common too. It seems very difficult, but if you are deaf, you just get used to it, and lip reading is quite common. And there's also cochlear implants, so there's surgery that you can do. There's different surgeries, but the most common is definitely cochlear implants. And then there's also captioning, so this is basically when you're watching a movie, if you're watching Netflix, you can always put the captions on, so that way somebody who is deaf, they can still be reading what's happening, so they know what's going on in the TV show or movie. Then we move on to texting. So texting is obviously super common. We're very good with technology nowadays. So now people can just text, which isn't always convenient if you don't have someone's phone number, but it's definitely an easy way to communicate with others fast. And then, like I said before, technology, with all the technology that we have today, there's definitely many ways to communicate. So next up, for my case study, my roommate here at school, she actually has moderate hearing loss. So I decided that I would talk about her and kind of do my prescription and the exercise testing related to her. So she is 22 years old. She graduated last year, and she does have moderate hearing loss. She uses hearing aids occasionally, but she's quite forgetful with them, and she also is embarrassed with them, which is very common because I know plenty of kids that wouldn't want to be wearing hearing aids, even though it is quite helpful. So she relies on captioning on TVs all the time. It's constantly on and it helps her a ton. And she also has just become really good at lip reading just from having hearing loss because she has had her moderate hearing loss since she was in elementary school. Um, so basically for her, she just said her goals were just to have better balance. She has really terrible balance, she said. She wants to be able to work out without the loud music because that really pumps her up and she relies on that a lot, but she knows that it can worsen her condition. And then also just to increase her cardiovascular endurance. So for her exercise testing, there's a few different tests that I would do. First off, for balance, the Romberg and Stork test. So the Romberg test, there's a few different variations where you can stand on a foam pad, stand with your feet together, your hands crossed like this. It's just a very good test of balance, and you stare straight ahead at a wall. And you can also do it with your eyes closed. That's another one of the variations. And there's also just the Stork test, which is in that picture on the side there with your hands on your hips and one leg up right around your knee area. And then next up is our 1RM bench press and squat, which is just testing muscular strength. And then lastly, she is 22, so she is fairly active and in shape. So I chose the Bruce treadmill test just because it's a fairly difficult test, and I think it would be good just to show improvement over time. So the next up is exercise prescription. So first off, for aerobic endurance, I read that basically you just want to do large muscle activities that can be done continuously, so that way it's not so start and stop and not having music or anything, because she wants to focus on not using music while exercising. So this would be easy because it's easy to walk, swim, cycle. You can do all of that without music, especially swimming. You don't need music and cycling. But so to do that for 30 minutes at a time and about 5 days a week, I told her a good tip is to focus on her breathing rhythm just to distract her, because you can focus on that type of rhythm instead of the rhythm of the music that you would normally listen to. So next up is muscular strength. Supersetting is a great idea in my opinion, just because you can alternate sets with your two different exercises, and so it's definitely fast paced. There's no time of like lagging, not having music to motivate you. There's no like rest to lose your motivation almost. So I thought this was a great idea. So to do this about 2 days a week, 10 to 15 reps. But yeah, just create a nice rhythm for you so you can get used to working out without music. Or you can even just have super low music in your ears, or just out in the open, and that way you don't have to rely on the loud music to like actually keep you motivated. Like you can just have it just to keep yourself on rhythm. So in conclusion, I just had one thing that I want to say. So for this in this whole class, we learned about all different special populations. I think we need to remember that whatever we learn about in class, not everybody is like suffering or they're not impaired with their disease, and it doesn't define who they are. I think that's super important to remember, just because people are always saying like, oh, it's so tough for them, blah, blah, blah. But I think it's more important just to talk about like what they can do with it and how they can live their life in a positive way. So yeah, thank you.